Thank you for being here today. My name is Dr. Rebecca Wells. I'm a joint faculty in the School of Social Work at the University of Georgia and also in the Department of Health Promotion and Behavior at the College of Public Health at UGA, and I coordinate the Master of Social Work, Master of Public Health dual degree program. I'm really excited to be here with you today, and I'm with Mrs. Allison Haynes, who is our Recruitment and Admissions Coordinator at the School of Social Work, and she's going to be helping me monitor the chat and facilitate this session. I'm going to share my screen, and we'll go over this information session about the MSW MPH program at UGA now. Can everyone see that okay? Great. Thank you so much. So you're all here because you're interested in graduate education. I want to just tell you briefly our agenda for today. We're going to talk a little bit about what graduate education means, and then we're going to jump into some information about the Master of Social Work program, the Master of Public Health program, and what it means to pursue a dual degree at the intersection of public health and social work. We will talk then about the Master of Social Work, Master of Public Health program at the University of Georgia, and then we'll talk about how to apply and also financial aid questions and things like that. So what is graduate education? Graduate education can mean a lot of things. At the Master of Social Work or Master of Public Health level, it's a terminal master's level graduate degree that's going to give you skills to practice in a particular profession. Typically, a master's program is going to involve a practicum or multiple practicum placements. Sometimes they might require a comprehensive exam, a thesis, or a capstone. So depending on the place you apply, it might have different requirements. You can stop with a Master of Social Work or a Master of Public Health and have that be your degree and have a good career. Some folks will find they want to go on and do a doctoral program, a research degree, or some other doctoral program. And also part of graduate education is certificates. So if you come to the University of Georgia, you would also have the opportunity to see if certificates could fit into your program of study. Graduate education is not something to be entered into lightly. It is a major commitment, and it's not something to do just because you don't know what else to do after graduation. It's a significant time commitment and a significant financial commitment. And so choosing the right program is a really important thing to do. So doing your research is what you should be doing, and you're all here, and that's a great sign to me that you're serious about your graduate education. When you're preparing for graduate education, you'll be thinking like, what degree do I want to do? What program? What university? What concentrations do I want to pursue? Who do I need to reach out to reach my goals? And so today we're going to talk about the Master of Social Work program at UGA and the Master of Public Health program here, and then how you can also combine those concurrently to get degrees in both disciplines. So the mission of our Master of Social Work program is to prepare graduate students for advanced social work practice. And we want our students to go out into the world and be future leaders that are culturally competent and practicing with cultural humility, dedicated to social justice, and committed to the core values of the social work profession. So the National Association of Social Workers is our professional body, and they have the Social Work Code of Ethics, and those are very important to our profession. Our school's values are a commitment to addressing power and oppression in society, to promote social justice using evidence-informed practice and advocacy, and the celebration of diversity. So that is a major part of our guiding curriculum of the Master of Social Work program at the University of Georgia. We have some options at UGA, and some of those are compatible with our Master of Social Work, Master of Public Health dual degree. We have our full-time MSW program. Sometimes I call that the traditional program, and that is on our Athens campus. For regular MSW students, that's 4 semesters. Another option we have is if folks come in with a Bachelor of Social Work from an accredited university, and they've gotten that in the past 5 years, they can do this advanced standing program, which is a shorter program and it's a bit accelerated. Our school also offers a couple of other part-time programs at our Gwinnett campus near Metro Atlanta, and also an online program. But neither of those programs are compatible with the Master of Public Health. So we only offer the Master of Social Work, Master of Public Health on the University of Georgia campus in Athens. There are 3 areas of specialization that our Master of Social Work students can choose. Micro is focusing on working with individuals, families, and groups in diverse settings. So you would get those skills in the micro concentration. We also have macro social work, which focuses more on communities and organizations, and also policy and advocacy. And then our third concentration for the MSW is our combined concentration, where you take 2 micro courses and 2 macro courses, and you get fewer electives. And so those are the MSW concentrations that we have here at UGA. And we'll talk more about these later when we talk about the dual program. If you are interested in applying to the MSW program, please explore our website for more information. I've just put up a screenshot of our MSW admissions website. And if you have questions about anything, you can reach out to myself or Mrs. Allison Haynes about that information. Now moving on to talking about the Master of Public Health program. UGA's College of Public Health has a mission to advance the health of all, and we do that through research, hands-on learning, community engagement, and service. The college has a commitment to improving the public's health locally, statewide, nationally, and globally. And we have a vision for a healthier, safer, more equitable world. And those are our core values at our college. And so you're going to see a lot of overlap between the mission and the vision and the values of public health and social work, just based on our vision and values of the 2 schools. Within public health, there are a lot of different concentrations that students can do for their Master of Public Health, but I'm going to highlight mainly the ones that we offer the MSW MPH with. So first, we have Health Promotion and Behavior, which is focusing on the social and behavioral determinants of public health. And students in this track learn how to plan, implement, and evaluate and research health promotion programs. We also offer gerontology for individuals who are interested in healthy aging and supporting older adults and public health in that aspect. And our third newest concentration is health policy and management, which focuses more on the business and political and policy side of health, and also healthcare and management. In our college, we also have concentrations in biostatistics, disaster management, environmental health, epidemiology, and while we don't have concentrations in those, students will take some coursework in those spaces as part of their Master of Public Health and can explore some of that in their electives. Similarly, with social work, we have the Master of Public Health website. A quick Google search, you can find the UGA Master of Public Health admissions page, and you can learn more about our on-campus MPH program. We have an online MPH as well, but just like with social work, that one is not able to be offered with the dual degree program. It's a separate curriculum and it's a separate fee structure, so we're only able to offer our MSW MPH in person in Athens. And now I'll move on and talk about public health social work and what that means. So both public health and social work have the social determinants of health as part of their vocabulary. And it's the recognition that we are all born into certain social conditions, that can affect our ability to achieve and maintain good health. And so these can be housing, socioeconomic status, etc. And the social determinants of health are shaped by the distribution of money, power, and resources. And these are factors that contribute to a person's state of health, and they can impact the health and well-being of individuals, families, and communities. So on this slide, I'm just showing you a little bit of the similarities and also the differences between the disciplines of social work and public health. So pursuing a dual degree, you would get training in both of these disciplines. And the mission of social work is to enhance human well-being and to meet the basic and complex needs of all people, especially focusing on vulnerable, oppressed populations in our society. With a social work background, you can get training to work with individuals, families, organizations, and communities. And you're going to be doing more you will have the skills to do client individual focused work, no matter what concentration you choose. With public health, there's more of a population level approach, and it is more of a macro discipline. And public health is focused on protecting and improving the public's health, and it focuses on prevention a lot more, and prevention is a key component of public health. Both disciplines have common goals, like I said, related to the social determinants of health. They also want to promote population well-being and advance social justice so that we can improve the health of diverse populations. There are so many areas where you can work with a background in public health and social work together, but I've just put a handful of selected areas on the screen. Maternal and child health is one big area where you could utilize your skills from public health and social work in a complementary way. We could also think about health equity at a macro level. How do we design policy so that healthcare services and other services and supports are accessible to people in an equitable way with quality? Health equity also could include environmental justice. Emergency preparedness and response is also a great area of overlap for public health and social work because we're thinking about vulnerable populations whenever a crisis occurs, whether it's a man-made disaster or a natural disaster. And then finally, also infectious disease, and working with populations that maybe have been historically marginalized is another space where public health social work skills can be really utilized to their fullest potential. So these are some areas of employment that you might find yourself wanting to go into after getting a public health social work degree. We do have students who go into clinical practice who do a more micro route, but they're also armed with those public health principles and the skills to do evaluation and programming. We have people who go into health education and health promotion, health program planning, like I said. We've had people go into health policy analysis, leadership positions, public health advocacy, and research. And then our next slide includes some job titles from our past graduates, places that they have gone and worked. People work their way up and are directors of programs. They are health educators. We have alumni who are working in private practice as licensed clinical social workers and have their own practice. We have people who are working in a university setting who might be doing program coordination or being a research coordinator for research projects that support populations that social workers and public health care about. We also have people working in case management, doing community organizing. We've had people work in higher education with our background. And then we've also had people work at the federal level. So sometimes people go into the Environmental Protection Agency, the Centers for Disease Control and Prevention. We've had alumni become health scientists at CDC, evaluators, and then also sometimes people work a while and then go back and take the background they got in our program as a springboard for a PhD program. So now I'm going to give you a little bit of information about the structure of our program. When we started our program, we did not have an advanced standing component. So we only have this traditional program, which is for students who don't have a bachelor's in social work. It's typically completed in 7 semesters, and that includes summers, and it's roughly about 2.5 years. It's offered in Athens, and students complete 90 credit hours and are able to share some of those credit hours between their Master of Social Work and their Master of Public Health degree. So the Master of Social Work for traditional students is a 60-hour program, and Public Health is a 45-hour program. Add those together, that's 105. But with our dual degree, you are able to shave off 15 of those credits and share them between the 2 degrees. Our students take concurrent, so at the same time, they're taking social work and public health courses. And our regular traditional students do a generalist social work practicum placement, and then they do a second placement, a specialization placement, but that is an integrated placement where they are completing their social work and public health hours in the same agency. And I'll show you a program of study in a little bit that'll hopefully illustrate some of this a little better. A few years ago, maybe 5 years ago, we got approval from the graduate school at UGA to get the advanced standing program for our MSW MPH students. And so again, to our knowledge, we're the only MSW MPH program in Georgia, and our advanced standing program is completed in 6 semesters, including summers. And students can complete that in 76 credit hours. Traditional advanced standing students are going to have 1 practicum placement, and that is the same for our MSW MPH students. But their practicum placement for that specialization placement is going to be a place that allows them to fulfill their social work and their public health hours in the same agency. And so when I said earlier, that graduate education is a major commitment, the practicum is another part of that major commitment. Our practicum placements typically are in spaces from 9 to 5, and so considering that as you plan for your graduate education future is also important. I mentioned earlier the different concentrations for social work and the different concentrations for public health. And so you're going to see on the left-hand side and the arrows pointing downward, those are our MPH concentrations. And then to the right of them, those are the social work concentrations that you can pursue. Unfortunately, because of the way the credit hours are shared, the only concentration that you can do a combined MSW with is health promotion and behavior. But all 3 concentrations, you could choose micro or macro to do your degree program. And I have well-developed prescriptive programs of study for each one of these. So when you enter the program, I would meet with you and work as your advisor to support you in following a program of study for your chosen concentrations. This is just a sample of how the courses look for someone who is doing the full-time MSW. We have 3 ways that students can start in the full-time MSW. Students can start in just social work classes. So fall of your first year, that's where you just do social work classes. And you are starting your generalist practicum in that semester, and you continue your generalist practicum here in the spring and continue coursework. You'll see that summer courses are a part of the program of study. Students would then go into their second year. They would be doing coursework again, but not having a practicum placement in that second year until the summer. So our program is set up where our MSW MPH students do an integrated practicum in the summer semester. And that is all the coursework you're taking in that semester. It's roughly 40 hours a week. And then you finish the social work part of that practicum in the fall of your third year. You finish your coursework, and then you graduate. So that is how you would start if you started in the MSW program with the dual degree. We also have it where you can start in the Master of Public Health program, and that means you start in courses focused on the MPH, and you do MSW and MPH coursework in the spring and summer, and then when you start your second year, that's when you do your generalist practicum, and same amount of hours as people who start in the MSW program. You're just happening to do that in the second year. And you would continue in practicum in the spring, and just like your counterparts who started in the MSW program, you would do your integrated practicum in the summer and finish that in year 3, in that 7th semester. The other way that you can do your curriculum is by starting in both. So starting in a mix of social work and public health classes in your first semester. This track, again, you are not going to do a generalist practicum until the second year. And you're just focusing in that first year on coursework. The second year is when you do your generalist practicum. And the same as our other tracks, you do your integrated practicum in the summer and finish it in the fall. So this is a decision you can make for yourself, and you can make that in concert or conversation with me. I'm happy to help folks think through what is best for them and what they want to do as far as which program to start in. Finally, our advanced standing program is a little more prescriptive because you, as an advanced standing student, have already covered some of that foundational social work coursework in your bachelor's program. And so our advanced standing students come right in the summer, and they start in a mix of public health and social work classes. And they continue in the fall with that coursework. In the spring, they do some internship preparation with faculty in the College of Public Health. And their second summer is more coursework. And then their second fall is when they are doing their specialization integrated practicum. And they finish that practicum in the second year. So again, traditional, you'll see 7 semesters, and advanced standing is 6 semesters. So if we haven't scared you off with all the coursework and all the internships and the practicum and all the talk, and you are interested in applying, I'm going to cover some of that now. And Ms. Allison Haynes is also going to help me cover some of that. So one of the things that's really important to remember is these are totally separate schools. The School of Social Work is its own school, and College of Public Health is its own school. And so the applications are totally separate. You can get admitted to one program and not be admitted to another. So if you are really interested in dual degree programs, I strongly recommend applying to both at the same time so you can see if you get into both at the same time. Each program has its unique admission criteria and process for admission. And if you are an international student, there are requirements through the graduate school that you can explore there. Ms. Haynes, anything you want to add on this slide?
No, that's everything for that one. Just be sure to apply to both programs. If you do it, ahead of time, you can make sure that you have that shortened track. So
great. So this is what the applications look like for each program. You'll see on the left-hand side, that's for the Master of Public Health, and on the right-hand side is the Master of Social Work. So not only am I the coordinator, but I also went through my own dual degree program when I was in my master's. So I went through the same process. And on the MPH side, there's something called SOFAS. It's called the Schools of Public Health Application System, which is a centralized application system. That is where our MPH applications live, and it can be helpful if you're applying to multiple MPH programs because you would probably be using SOFAS for that. There is a fee for that. It is kind of steep. It's around $150 for that first application to SOFAS. SOFAS occasionally has fee waivers, and so you have to reach out to SOFAS about that, and there's information on their website about that. Public health requires 3 letters of recommendation and transcripts from every college you attended. Part of the SOFAS application process is also entering your coursework into SOFAS, and so you'll have to do that. We do recommend that you are really diligent about your transcripts because SOFAS is very picky. If you did any dual enrollment English course in high school, for example, where you were getting high school credit and college credit, that could show up, and SOFAS might delay your application if you do not include that transcript. So it's very important to do that and to also monitor your SOFAS account to make sure nothing is holding up your application. Besides that, we also require a resume, a statement of purpose, and then there is a small processing fee for the graduate school. That's typically $25. And the UGA MPH program recommends a 3.0 GPA. Applications have to be complete before we review them. So it's really important to not just press submit and step away for months, but to press submit and then check on it periodically and be in touch with us here at the school if you think something's wrong. On the MSW side, you're going to be applying through the UGA Graduate School. There's an application and a fee. Similarly, we have 3 letters of recommendation that are required for the MSW program. And I encourage students, if you feel that the same 3 people could give you a strong recommendation for both degrees, feel free to use those same 3 people. Sometimes we have to help our recommenders understand what social work is or what public health is. So I recommend students maybe share our webpage with their recommenders, share the values of social work or public health to help them in that. But it can be the same 3 people, and they just need to tailor your letter to the program that it is for. So they need to talk about public health in your public health letter, and they need to talk about social work in your social work letter. Similarly, transcripts from every college you attended are required, and a resume and a narrative statement. And you'll be monitoring the graduate application portal. And the GRE is no longer required for either program, but if you had some issues in undergrad, maybe had a lower GPA than you would have liked, and you feel that the GRE could bolster your application, you are welcome to submit scores for the GRE. Ms. Haynes, do you have anything to add to this one?
No, that was exactly what I was going to say about the letters of recommendation, that you would want to explain to your recommenders that you're applying to these 2 separate programs and your career goals with that, and let them know they will have to tailor the letter to each program and upload them twice to those 2 separate. Because what happens is you enter their contact information into the application portal, and then they'll receive an email to upload the letter. So just be sure that they understand that it will be a separate letter to both programs.
Right, thank you. So yeah, when is everything due? Now we know what's due. When is it due? For the MPH program, they recommend you submit by January 5th to be considered for any available assistantships and financial aid opportunities. And the MPH program will accept applications all the way up through May 1st. So if you can't get it in by January 5th, you have until May 1st. On the MSW side, all MSW applications are due January 10th, and those that are received after the 10th are going to be reviewed on a space available basis. So to get the greatest chance of getting into the program and getting possible assistance, meet that January 10th deadline. Also, if you're interested in an assistantship, which is it is a mechanism that allows people to work for the School of Social Work in exchange for compensation and discounted tuition. You also need to submit that application, which is a separate application, by January 10th as well. And that's a good segue into talking about finances. So, finances are a big part of graduate school. Be prepared to pay the rate for Master of Public Health students. It's about, $3 to $5 more per credit hour. It's just slightly higher. So students, because they're in both programs, are just charged a higher rate, which is the MPH rate. Traditional students need to be prepared to take classes for 7 semesters and know that fall and spring you pay for the entire semester, but when you take summer classes, that's per credit hour. And then advanced standing students should pay for courses for 6 semesters. And again, summer is per credit hour for that as well. So the University of Georgia Bursar's website has information about tuition rates, a cost calculator, and all of those things. And besides tuition, students need to also be prepared to pay fees. So tuition and fees are part of graduate education. There's not as many scholarships available for graduate education as there are undergraduate education. So it's important to know that you're going to want to apply for as many scholarships as you can. Also consider graduate assistantships, like I mentioned, and also consider that you might have to take out student loans if getting your graduate degree at this time is important to you and you need that support. So on the left-hand side, students can apply for scholarships and assistantships through the College of Public Health, or the larger university. Sometimes there's opportunities within the university for graduate assistantships. And then also you can reach out to the graduate coordinator in whatever department you're interested in to see what might be available. And student loans also for public health. On the social work side, we have a number of financial aid resources on our website. You could apply for this assistantships through social work. There's also scholarships, and there are a couple of internship programs that students can apply for that might give them some financial aid. And so you're encouraged to go to our website and explore all of these resources. And these are who you might contact if you have questions. So I'm Dr. Wells. I can tell you about our structure of our dual degree program and give some high-level advising about things. But Ms. Allison Haynes in social work is going to be a good contact for your social work application. And then in public health, Ms. Lindsey Tucker, who is our MPH admissions coordinator, would be the best person for those questions.